Hi, I'm Angie, your healthcare guide. Today, we're diving into what should be one of the most straightforward documents from your health insurance company, but is arguably the one that confuses us the most as soon as we start receiving care. That's right, the Summary of Benefits and Coverage, or SBC. Some plans may refer to this as the benefit summary, the plan summary, or coverage overview. If you've ever looked at this document and thought, what is all of this and how do I make sense of this? You are not alone. If this is your first time here, hi, I am so glad you're here. With over 20 years experience in healthcare and a degree in healthcare management, I am here to give you simple, clear explanations with real examples. So let's dive into that SBC. First, what is an SBC? It's a standardized document that health insurance companies provide to help you understand your coverage. Think of it as a snapshot of your plan's costs, benefits, and limitations all in one place. Here's some examples from the Centers for Medicare and Medicaid Services, or CMS. At the top, we have the insurance company and plan option name. This is going to be your insurance company and then whatever plan you've picked. In the top right, we have the coverage period. This is typically going to be a calendar year from 1/1 to 12/31. Now remember, this means that your deductible and your out-of-pocket limit are going to reset after that calendar year. Additionally, as part of the SBC, we're going to see what you would pay if you went to certain doctor's visits, if you had certain tests, or if you're being treated for certain conditions. We're also going to see different office visits, emergency care visits, outpatient and inpatient services. Additionally, we're going to see those excluded services from your plan, and then the covered services that are also included in the plan, but not spelled out as to what your coinsurance or copay might be. On the last page of SBCs, we're typically going to see a couple of coverage examples that are specific to that particular plan. So it'll show that plan's deductible, what you might pay for coinsurance or copay, and then the total example amount that you would pay. Now we're going to go back to the beginning page of this example. See that deductible at the top? We have that overall deductible, that $500 individual or $1,000 family. What does that actually mean? So let's break it down. The deductible is the amount you pay out of pocket for covered services before your insurance actually starts paying. So with a $500 deductible, you would pay the first $500 of your medical bills each year. Then your insurance helps with the rest. Next, we have copayments. So the copayment is a fixed amount you pay for a specific service. Think $35 for a primary care visit, $50 for a specialty visit, and so on. You'll want to check your SBCs to see your specific copay amounts for things like primary care and specialty visits. Next, we have that coinsurance. This is going to be your share of costs, calculated at the percentage of that allowed amount for the service. For instance, you're going to pay 20% while your insurance pays the other 80% of that service. And finally, that out-of-pocket limit. This is going to be the maximum or most you will pay in a year for covered services. Once you hit this limit, say $2,500, your insurance covers 100% of those additional costs. It's kind of like your safety net. Let's take a look at a real SBC from Cigna. Here we look to see that the primary care visit shows that we're going to have a $15 copay per visit. That means you'll pay $15 each time you see your primary care provider. Pretty straightforward, right? Here's another from Regents. This plan's overall deductible is going to be $7,000 for individual, $14,000 for family per calendar year. So you'd need to spend $7,000 on covered services before your insurance starts sharing that cost. Now we're going to take a look at an example visit. Jane broke her arm. She had to have an emergency visit. Let's see what Jane is going to pay versus what her insurance is going to pay. In this example, Jane has $500 deductible. She goes to the emergency room and the bill is $5,000. She hasn't met any of her deductible yet, so she will need to pay that full $500. After she's met her deductible, her insurance will pay that 80% of the remainder of her bill. That's $3,600, which means Jane will pay the remaining 20%, or $900. With that deductible of $500 and the $900 for her portion of coinsurance, Jane is going to owe a total of $1,400. Make sense? That was a quick look at an SBC. I hope this helped you understand your own health insurance coverage a bit better. On your healthcare guide, we'll keep tackling topics like this every week. Things like, what does in-network versus out-of-network really mean? And when do I need a referral versus when do I need a prior authorization? If you have a confusing healthcare topic that you'd like me to dive into, go ahead and leave a comment below. And if you like this video and found it helpful, go ahead and subscribe, like, and share. Thanks for watching. I'll see you on the next one.